uplifting way to end this course, isn't it? So that could be a suggestion for a follow-up course. Happiness, yes.
I always understood that we only utilize a fraction of our brain's area or
right.
So does the degenerative process affect all of the brain in the same way?
Right. So I think that, I mean, actually that is an important question. I mean, so do we only utilize a certain percent? We do. I mean, our brains are always being fully utilized, but some parts are being utilized much more. And so that's what some people have said is because, so with, let's say, Alzheimer's, the pathology is starting in that memory-related center, that learning and memory-related center. And that part of the brain, that's where, you know, epilepsy can often be generated from. That's where, you know, obviously Alzheimer's starts from. So for whatever reason, this part of the brain is being really used all the time. And that's probably why it's sensitive to its own, you know, death and destruction, but also its own rebirth. And so when I talked about the idea of new cells being born, there are new cells being born in this part of the brain, but there are cells at almost a higher rate that are dying every day. So it's this, you know, it's this cell death that's going up and cell rebirth that's trying to keep up, but they just can't keep up. So it's a really overworked part of the brain, just like the substantia nigra with Parkinson's disease. The more that they seem to work, you know, to control, to help us do our, you know, everyday behaviors, the more susceptible they seem to be to degeneration. But we do use our whole part of the brain, but those parts that are more active seem to be more sensitive to degeneration. So the economic burden. So again, this is more in terms of what I think is just thinking about some of the different disorders, diseases that we've talked about. So I didn't really talk about addiction, but the economic burden of addiction is almost $400 billion. And I think part of that is that because people who start taking drugs are so young, and then they live, you know, for a long time, but they become a burden to society. Yeah.
Is this Canada?
No, I think this is the international, but yeah, so this was from that international report. So yeah, this is worldwide. And then you can see number 2, Alzheimer's disease. So I think this only is looking at causes, I guess, of dementia. So Alzheimer's disease would cause dementia. Not sure obesity would necessarily cause dementia, but you can see that so these are, you know, potential topics for follow-up courses. So, you know, what causes chronic pain? What are the depressive disorders? So anxiety, attention disorders are way up there, sleep disorders, you know, stroke we talked about, vision and hearing loss are, you know, have their own economic burden, anxiety, schizophrenia, epilepsy, which we've covered, Parkinson's, and MS, which we've covered. So you can see that there is a pretty significant international economic burden to a lot of the different diseases that we've talked about, and trying to understand those can, you know, potentially lead to reducing that economic burden. But addiction is one that, I mean, that's a really complicated one because, as I said, it's probably likely that, you know, people who start taking drugs who get addicted at a young age and then live a long life sometimes. So the global prevalence of dementia. So this is kind of, these are projections about, you know, the growth in numbers of people with dementia. So what they're saying is that in high-income countries like, you know, Canada, you see a sort of a relatively steady increase, but not as significant as these low and middle-income countries. So you go from where we are now, you know, 2013, and the projection is that it's going to almost double. So people with dementia in these low and middle income countries is, you know, I guess predicted to double over the next, what are we, about 40 years.
Is that why they're going to live longer?
Right, so that's a good, the why. So from the authors, so this is essentially, this is what the authors of that report say, is that there's just a general lack of awareness of Alzheimer's and other dementias. So as, you know, as they learn more about what is dementia, so this is actually, I think, an interesting part. So these dementias are perceived as a normal part of aging, which I think is an interesting way of looking at it. So that, you know, in these lower to middle income countries, they don't think that, you know, these dementias, those symptoms of dementia, are anything to be concerned about. They just figure that it's a part of the normal aging process. Whereas, you know, we, up in our higher income countries, say that no, actually there is you've crossed the line from normal aging to dementia, so now you must be aware of this, and so that's why probably the prevalence will skyrocket like that, just more of an awareness. And that's, another sort of related to this is what I think is happening, on the topic that we covered is concussion. So, concussion, the prevalence is probably skyrocketing right now. There's probably no more people getting donked on the head and having concussions. It's just more of an awareness of what an actual concussion is. So in this case, it's more an awareness of what dementia is and what defines dementia.
What is a middle-income country, for instance?
Middle income. Yeah, I suppose some Mexico.
Malaysia would be an example.
Which one?
Malaysia.
Malaysia? Okay. Yeah, would Canada be middle income or classified as high income? High income. Yeah. Did you?
The difference between the tangles in the neurons from a concussion and from a degenerative disease.
Yeah, so you're right. So actually, I'll come back to that pathology. Yeah. So just remind me if I don't. So the difference between the concussion damage versus an Alzheimer's type damage. Yeah. So this general lack of awareness has important consequences, I guess, in terms of just being able to treat these dementias. I suppose. So again, just to get on my soapbox, to have a little bit of an outreach, is that this dementia can be linked to a large number of underlying brain pathologies. So Alzheimer's is the actual pathology, Parkinson's is the pathology. Any of those is what's happening to the brain that then leads to these behavioral changes. So these are, the most common. Alzheimer's disease is the most common cause of dementia. Vascular dementia, so again, the decrease in blood flow, so similar to, I just talked about in strokes, that can lead to dementia. I didn't talk about these Lewy bodies, but those are actually found in Parkinson's disease, they're found in Alzheimer's disease. And these are, I won't get into any more detail on that, but that's why some people think that Alzheimer's and Parkinson's are very similar diseases, because they both have these strange intracellular developments, or these protein misfoldings and things like that. And then frontotemporal dementia, which is similar to Alzheimer's, so the frontal lobe and the temporal lobe start to degenerate, which is exactly what you see in Alzheimer's disease, but this frontotemporal dementia then can be probably related to a lot different factors than the development of these plaques and tangles. So this might be due to, let's say, a head trauma or concussion-like injuries. So the characteristics of dementia subtypes, I won't go into this in any great depth, but just, again, what we're talking about is Alzheimer's disease. So the early characteristic symptoms: impaired memory, depression. There's a gradual onset, so it's slow as it develops. The neuropathology are these plaques, these tangles, and then the proportion of cases of dementia, here it says 50 to 75%, very similar to what I had said, 65%. And then as you go down, it's vascular dementia, the Lewy bodies less than 5%, and the frontal temporal dementia is 5 to 10%. So again, I think this is probably what some people are saying is related to repeated head traumas, repeated concussions, because as it says, no single pathology, but the damage is limited to the frontal and temporal lobes. So those two parts of the brain that really work hard to keep us who we are, to help us remember things, to keep our personality intact. And this actually is affecting more of a younger generation. It's kind of sad. So this is one of these, I guess, conundrums. So we all have jelly beans in our brains right now. So we all have that pathology, but we don't show any signs of dementia. So again, this is one of these, I think, a problem with a lot of brain disorders that we've been talking about and that we could talk about, is that and if we just focus on Alzheimer's, as we have the syrup floating around, sometimes it will accumulate and turn into these plaques that are in our brain. And by about again, the magic number of 40, once you hit 40, these plaques start to accumulate a bit more and more. But people, not everybody's developing dementia. I guess we slowly do. A lot of people will develop dementia, but oftentimes at autopsy, if you look at a brain of a person who had no signs of dementia, they actually show Alzheimer's-like pathology. So again, it's one of these things that, Alzheimer's disease develops over a period of about 20 to 30 years before symptoms become noticeable. So it's, like the pathology is there, but the symptoms are not. So that's the great thing about the brain, and that's a good take-home message, is that it can deal with damage to itself and then overcome, it can compensate those patterns of degeneration.
Are there any similarities between the type of dementia associated with mad cow disease or the cannibals in the beginning that were eating brain and developing severe dementia? Is the pathology similar to Alzheimer's? Is it lots of tangles?
Yeah, so in those cases, so that's so the case of like Creutzfeldt-Jakob disease or mad cow disease, and then in South America, I think it's kuru, or they eat brains and spinal cords of deceased individuals. So in those cases, what it is that's more like a virus in that case. So it's called a prion disease, and so it's these prions that they're actually proteins in the brain, but they start to malfunction, misfold, and then they can actually convert other proteins, and that will spread throughout the brain. But it's not the same underlying pathology, but it seems to start in the same parts of the brain. So that temporal lobe, that memory part of the brain, and then spread forward to the frontal lobes and cause dementia for some reason. So it's not, again, it's one of these things that these diseases, I don't think I have these diseases seem to progress, at least the pathology, in this, in parts of the brain that are really active. And so I don't, it's interesting whether whatever is causing the pathology, so at least in prion diseases, if they get attracted to all the activity, if there's a lot of glucose uptake or whatever it is, or the microglia, and then they just, follow the course of activity. So you think about how much we use our frontal lobes day to day. I mean, 30% of your brain is the frontal lobes, and that, right there, that part of the brain is active all the time. So, that means that we are using more than 10% of our brain because we're always using our frontal lobes. So it's a really highly active part of the brain that then, for whatever reason, is susceptible to getting damage. So again, this is now a bit of my soapbox, is the only way to define Alzheimer's is through an autopsy. So Alzheimer's defined his disease as those plaques and tangles in the brain. So you can say that there's probable, fairly accurately, whether a person is having memory problems as possible Alzheimer's disease or probable Alzheimer's disease when no other cause for the symptoms can be found. So if you haven't had strokes, if you haven't had major head trauma, if you don't have, the motor symptoms that would be associated with Parkinson's disease, a physician would say probable Alzheimer's disease. But then again, I mean, there's, for this another sort of take-home message on this whole, from this class, is that a lot of the treatments for these brain disorders are not, they're not magic bullets. So does it matter to the individual? I mean, you could take some breakthrough treatments to treat Alzheimer's pathology, but in the end, it's probably not going to really do that much, except help you prevent the symptoms from progressing really rapidly. So does it matter to the person, whatever the underlying cause is, that they have dementia? I think that was kind of related to your point before.
What are the treatments?
I'll get to some of the treatments in a bit, but not much. So again, in this case, what would a physician do? Oh boy, it's quarter after. So the tests most sensitive to early Alzheimer's are these memory measures. So that's the first aspect of dementia that starts to come up. And then verbal ability also starts to show decline. So, the verbal ability is also sort of seated in the, I guess I better do it this way, in the left hemisphere. So down in here, right about where the memory functions are. So now we're talking about Alzheimer's, is that part of the brain starts to also degenerate. So you not only have the memory issues, you have verbal abilities that start to decrease, and then the cognitive symptoms. But as it says there, these neuropsych tests are, it's difficult to distinguish different types of dementia. So, is it caused by lack of vascular flow? Is it caused by Alzheimer's? What is it caused by? So I'll let you just look at these, but these are just the symptom progression, so that when you get to severe Alzheimer's, you have memory problems, cognitive personality changes, wandering, aggression, things like that. So it's a real serious issue. Like this is about the time where you don't recognize your own children, and that's when you've crossed the line into dementia. So back to the neuropathology, I think I'll just try to quickly go through this because I've already sort of talked about it. So you have the plaques, you have the tangles. So the plaques would be, in this case, the jelly beans. The tangles would be the axons that are getting, really like solid. They're not malleable anymore. And then what happens, so there's just kind of a cartoon of a plaque. What starts to happen is that you have a degeneration. So you have neurons that start to shrink up, die off, and then the brain shrinks. And but again, that progression is severe Alzheimer's. That's what you can see on an MRI. You don't typically see the development of Alzheimer's. So in the first 15 years, you could be developing Alzheimer's and never actually see any changes in the brain at the bigger level, at the degenerative level. So now we go back to one of our old friends, the microglia. So again, here you have these plaques that are forming. They're interfering with the connections between neurons. And so once that starts to happen, you develop these tangles within the neuron. But as all this is going on, microglia come in to try to clean out those plaques, so to turn those jelly beans back into syrup. And what they're doing is they're now dumping off their own toxic chemicals, and that's now also contributing to the degeneration that you'd see. So this is something that I didn't actually include I just put in this morning, but those, like I said, I think a common denominator in a lot of disorders that we've talked about is this neuron, the microglia response, the inflammation. So there's a group up in Quebec, University of Laval, that is looking at stopping those microglia from becoming activated, so that so again, you have these plaques being formed, the microglia come in, and they actually bind all those proteins that form up the plaque. They bind it, and they start to, okay, I got to deal with this. I got to clean it out. I got to chew up the jelly beans to make syrup. And as they're doing that, you can see these toxins coming out and infiltrating this neuron and can actually now destroy that neuron. So what these guys in Quebec are doing is blocking the ability of these microglia to detect those plaques and stop them actually from working. So that's one way to sort of short circuit that additional damage. I did not include this in the slides if you're looking for it, but I just thought it's interesting because that's one way to actually treat this, is to go after those microglia. So I'm going to jump over. So again, that's when you have this advanced Alzheimer's, after you've had those plaques form, those tangles form, those microglia response, you start to get degeneration in the brain. So then you can see it on a MRI scan. So again, the risk factors in Alzheimer's, age is clearly one, developing not only Alzheimer's but dementia. 1 out of 8 people over the age of 65 has Alzheimer's. Almost 1 out of every 2 over the age of 85 has Alzheimer's, or I should say probably probable Alzheimer's. So age is clearly something you can't really do about. Genetic factors, there's a contribution of genes. There has been a lot of work into this. And again, it's one of those things that, what do you do with that information? Once you find out you have a particular gene, there's currently a lot of work going into gene therapy, but at the moment it's the next step. It's trying to find out how you can stop those genes from making the brain go into the state of pathology. So it's the risk factor. It's an APOE4 gene. Again, it doesn't really matter, but increases the likelihood of developing Alzheimer's, but does not guarantee it. And I think, again, that's a real important statement in terms of all the risk factors with all these diseases that we talk about. You can have an increased likelihood of developing a particular disease, but it's not guaranteed that you will if you have that genetic makeup. So again, I think in terms of the global treatment of Alzheimer's, it's what most people are looking at is how you can stop those plaques from forming. So it seems that the plaques are the ones that are really setting off this cascade. They're impairing the ability of neurons to communicate with each other, so then they cause degeneration. They also activate microglia that come in to try to chew them up, that lead to more toxic release in the brain. So what the idea is that you want to turn, this is one of the you know, one of these treatments is to turn these plaques, you know, these accumulated jelly beans back into serum so that you can clear out those plaques and get the brain working back to normal. And if you clear out those plaques, you'll stop the ability of those microglia to come in. And so I think that's been a focus of a lot of treatment strategies in terms of Alzheimer's, and with, you know, in conjunction with the microglia responses that I just talked about. So, conclusions. Let's wrap this up. So I didn't really know how to conclude this whole class, not just today's lecture, but the whole course. But I think there's a couple of quotes, so I spent about probably 3 hours looking at on the internet for quotes about the brain. And I like this. Antonio Damasio is a pretty well-established researcher on brain, and he does, you know, work between the emotions and the brain. So I'd like, you know, if you remember, I started out talking about, you know, we can forget our mind.